चुप हो जाए हो, जब मोहब्बत दर्द बन जाए, खामोशी में आंसू आए, हम तुम्हारे साथ हैं यहाँ, तुम अकेले नहीं हो जा। हम सुनते हैं, समझते हैं, सच के जरिए दिल भरते हैं, हम तुम्हारे साथ हैं, हर दर्द के बाद भी राहें, मोहब्बत फिर से जीतेगी, टूटी सांसों को दे जिंदगी, यकीनी और सच के साथ मिल जाएगा तुम्हें रास्ता, उम्मीद होगी रहनुमा, हम तुम्हारे साथ हैं। महकमी समझता है हर कहानी का दर्द, आंसू जो छुप कर बहते हैं, हम उनको भी महसूस करते हैं। ऑनलाइन हम पास है तुम्हारे, रहनुमा है हम दिल के प्यारे, तुम्हारे साथ हैं, हर दर्द के बाद भी राहें, मोहब्बत फिर से जीतेगी, टूटी सांसों को दे जिंदगी, यकीन और सच के साथ मिल जाएगा तुम्हें रास्ता, उम्मीद होगी रहनुमा, हम तुम्हारे साथ हैं।
रिश्तों का दर्द, जज्बात की चोट, टूटा हुआ भरोसा, चुप से जिंदगी, लेकिन तुम अकेले नहीं हो, हम महकमी तुम्हारे साथ है।
प्रोफेशनल ऑनलाइन थेरेपी,
रिलेशनशिप तंगी तो शुरू होती है,
हम तुम्हारे साथ हैं, हर दर्द के बाद भी राहें, साथ चलते रहना है, दिल को फिर से जीना है, अंधेरों को छोड़ दो, रोशनी को रोक लो, महकमी है यहाँ, हम तुम्हारे साथ हैं।
दिल को शिफा, जिंदगी को राह, अमीन शिफा, जिंदगी को राह।
This is IMAHRKMI, and you're watching Insight Health Matters Live, where we explore the foundations of premarital counseling and the art of managing stress to build healthier, stronger relationships. Because the right understanding can change everything.
Good evening, everyone, and welcome to another enlightening episode of Inside Health Matters Live, where we explore important health topics with experts from different fields to help you live healthier, happier, and more informed lives. I'm your host, María, a food engineer by profession and someone deeply passionate about promoting health education. While nutrition and food science play a vital role in our physical well being, today's discussions remind us that good health is much more than what we eat. Our emotional and psychological health is equally important. Mental health affects how we think, feel, communicate, make decisions, and respond to life challenges. Yet many people continue to struggle silently because of a stigma, misunderstanding, or lack of awareness. So today's topic is one that touches millions of lives around the world. The silent epidemic, understanding trauma, anxiety, and emotional healing. Whether you are a student, parent, healthcare professional, employee, business leader, or simply someone trying to navigate life challenges, today's discussion is for you. So, to guide us through this important conversation, we have an outstanding guest. It is my pleasure to welcome Ms. Zahra Ali, a clinical psychologist and assistant manager at IMAHRKMI, a US-based organization committing to supporting professional development and initiatives that contribute to healthier communities. Mrs. Zahra has worked extensively in psychological assessment, emotional well-being, counseling, and mental health awareness. Her experience include helping individuals better understand stress, anxiety, trauma, emotional resilience, and evidence-based approaches to physical psychological care. Mrs. Sarah, welcome to Inside Health Matters Life. Thank you for joining us today.
Thank you so much, Miss Maria, and it's truly a pleasure to be here. And I appreciate the opportunity, to discuss a topic that affects nearly every family in one way or another. So, mental health is something we all have, just like physical health, and it often receives far less attention than it deserves. I'm excited to have this conversation because awareness is the first step towards healing.
We are delighted to have you with us. Let's begin with a simple question. Many people hear terms like mental health, trauma, stress, and anxiety almost every day. Sometimes these words are used interchangeably. Could you explain what mental health actually means?
Absolutely, Maria. Mental health isn't simply the absence of mental illness, right? And according to widely accepted psychological understanding, mental health refers to a person's emotional, psychological, and social well being, and it influences how we think, feel, behave, and build relationship and cope with the stress and make decisions throughout their life. So imagine just like the mind as the operating system of a computer. If the computer system is functioning efficiently, we communicate better, we have mental health is healthy and we solve the problems more effectively and maintain healthier relationship and recover more quickly from difficult experiences. And on the other hand, when our mental health is struggling, even routine daily life activities can begin to feel overwhelming.
Yeah, that's very helpful comparison. Many people focus on physical health because they can see a broken bone or a fever, but mental health challenges are often invisible. What do you think mental health continues to carry so much stigma?
Yeah, Maria, there are several reasons, and historically, psychological illnesses were misunderstood, and people often believe that emotional struggles, reflect weaknesses, poor character, or a lack of faith, rather than recognizing them as legitimate health conditions, which is influenced by biological, psychological, and social factors. So, culture also plays its role. Many people grow up hearing phrases like be strong, don't cry, just move on, and everyone has problems. So, while these statements are usually well intentioned and they can unintentionally discourage people from seeking help. And another reason is the fear. People often worry about being judged by the family, friends, employers, or the society. And unfortunately, this fear causes many individuals to suffer silently for years before reaching out for support.
Okay, that's heartbreaking because silence often makes problems worse. Let's move on to the main topic. So, the word trauma is becoming increasingly common nowadays. Some people think trauma only refers to war or natural disasters. Is that true?
Absolutely not at all, Maria, because trauma is much broader than many people realize. Psychologically, trauma refers to any emotional response to an event or series of events that overwhelms a person's ability to cope, and different experiences can be traumatic for different people. Examples may include like physical abuse, emotional abuse, sexual abuse, childhood neglect, bullying, serious accidents, domestic violence, sudden loss of a loved one, and chronic illnesses, medical emergencies, community violence, and natural disasters. Even repeated criticism during childhood can also have lasting psychological effects if it significantly affects a child's, developing concept of safety and self-worth. So what's important to understand is that trauma is defined not only by the event itself, but also by how the brain and the body respond to it.
That is very important distinction. So, two people can experience the same event but respond very differently.
Exactly. Psychology teaches us that every individual is unique in the nature and the genetics, personality, previous, experiences, social support, coping skills, and even brain development all influence how we think to difficult situations. Just imagine two children experiencing the same stressful event. One has supportive parents, caring teachers and trusted friends, and the other experiences the same event but has no emotional support. Although the event is identical for both of them, but their long term psychological outcomes may be very different. And supportive relationships often, you know, act as protective factors that reduce the long term impact of adversity.
That's fascinating. It reminds us that kindness and support truly matter. Now, I would like to ask something many viewers may wonder. Can childhood experience continue affecting us even when we become adults?
Absolutely, Maria. In fact, one of the strongest findings in modern psychology is that childhood experiences can shape adult emotional health in profound ways. During childhood, the brain is basically rapidly developing, and children are learning that how safe the world is for them, whether people can be trusted or not, and how emotions should be expressed in a healthier way, how relationships work, and whether they themselves are worthy of love and respect. So, when children consistently experience safety, encouragement, and affection, they often develop secure emotional foundations. And however, prolonged exposure to fear, neglect, instability, or harsh criticism can influence emotional development and coping patterns later in life. So this doesn't mean that a person's future is determined by the childhood experiences, but people also can and do heal, and especially with supportive relationships, healthy coping strategies, and appropriate psychological care. But understanding those early experiences, can provide a valuable insight into current challenges.
Okay, so now let's dive deeper into the science behind it. Miss Sarah, many people say, I know trauma affects emotions, but does it actually change the brain? What does psychological tell us?
That's an excellent question, Maria. The answer is absolutely yes. Trauma can influence how the brain processes information, emotions, and perceived threats. because the brain is remarkably adaptable. And during overwhelming experiences, it may prioritize survival over the other functions. So there are basically three brain regions that are commonly discussed in relationship to trauma. The first one is amygdala, often described as the brain's alarm system, and its role is to detect, potential danger and trigger a survival response. And after a significant trauma, this alarm system can become overly sensitive and making a person react strongly even when there is no immediate threat. The second region is hippocampus, which helps, to organize memories and place events in context. So trauma may affect how memories are stored, and which is one of the reasons that some people experience, vivid flashbacks or find certain memories fragmented. And the last region is prefrontal cortex, basically, which is involved in decision making, planning, emotional regulation, and rational thinking. And during periods of intense stress, this part of the brain may be less effective, and making it harder to think clearly or manage strong emotions. And one of the important thing is that the brain is capable of change throughout the life, and through therapy, supportive relationships, healthy habits, and repeated positive experiences, people can strengthen healthier patterns over the time.
Okay, that's fascinating because it shows there is a biological component to emotional struggles. Sometimes people say like, just stop worrying. From what you're explaining, it's not that simple.
Exactly, Maria. Imagine just telling someone with a broken leg to just run. So most people would recognize that healing takes time and appropriate care. Similarly, when someone has experienced, chronic stress or trauma, their emotional responses are influenced by the real psychological and biological processes, compassion, understanding, and evidence-based support that are often far more helpful than judgment.
That leads perfectly into anxiety. Today, almost everyone says that they are anxious students, parents, professionals, even children. But what is exactly anxiety?
Yeah, Maria, anxiety is a normal human emotion, in an appropriate situations, it basically help you to prepare for challenges, stay alert, and respond to potential danger. For example, feeling nervous before an important presentation or examination is a common experience. And the concern arises when basically anxiety becomes persistent, intense, or begins interfering with daily life. For example, a person may experience constant worrying, difficulty concentrating, restlessness, muscle tension, sleep disturbances, racing thoughts, irritability, rapid heartbeat, shortness of breath, sweating, and a sense that something terrible is about to happen. So when these symptoms become frequent or impair work, relationship, or daily functioning, it's appropriate to seek, a professional assessment.
Many viewers may recognize those symptoms. Could you explain what happens in the body during anxiety?
Exactly, Maria. When the brain perceives a threat, it basically activates your body's stress response, which is often referred to as a fight or flight or freeze response. So, stress hormones prepare the body to respond by increasing, your heart rate, directing blood toward major muscles, and sharpening attention and increasing breathing rate. These reactions are useful if someone, needs to escape immediate danger. But however, when the stress response is activated repeatedly by ongoing worries, unresolved traumas, or chronic pressure, it can become exhausting, and over the time, chronic stress may affect sleep, concentration, mood, relationship, and overall your well-being.
So the body can always distinguish between a natural emergency and a perceived one.
That's correct, Maria. For example, someone who experiences repeatedly bullying in school may later feel intense anxiety before speaking in front of colleagues. Even in a supportive workplace, their current environment is different, but their brain may still associate the public attention with emotional danger. So, this illustrates how past experiences can influence present reactions.
Oh, that's a powerful example. Let's talk about emotional regulation. Many people have heard that term, but they are not sure what it means.
Yeah, Maria. Emotional regulation is your ability to recognize, understand, and respond to emotions in a constructive way. It doesn't mean that suppressing your feelings and pretending that everything is fine. Instead, it involves acknowledging emotions and choosing healthy responses. Imagine just two colleagues, who both receive unexpected criticism. One immediately becomes angry, raises their voice, and later regrets what they said, and the other one feels disappointed but pauses, reflects on their feedback and responds calmly. So both experience the same emotion, but they regulated it in a different way. So emotional regulation is a skill basically that can be strengthened through practice.
Okay, so can people improve this skill even if they weren't taught healthy emotional habits growing up?
Absolutely, Maria. One of the encouraging findings in psychology is that emotional skills can be learned throughout the life. Some practical strategies may include, developing awareness of emotional triggers, naming your emotions accurately instead of saying only I'm fine or I'm stressed, practicing healthy breathing techniques during the moments of tensions, and maintaining regular sleep routines, staying physically active, building supportive relationships, and learning healthy communication skills, and seeking professional support when needed. Small consistent changes often have meaningful long-term effects.
Okay, so I think many people believe healing should happen overnight. Is recovery usually a quick process?
Maria, healing is really a straight line. Some days a person may feel confident and hopeful, and the other days old emotions may surface again. So this doesn't necessarily mean that they are back at the beginning. Recovery often, involves a gradual process rather than perfection. So think of someone recovering from a physical injury, and there are good days and there are challenging days, but each step, continues to overall healing. So the same principle also goes with emotional recovery.
Okay, so I appreciate that perspective because it sets realistic expectations. Now, I would like to address a topic that often comes up in families. Sometimes people say, like, talking about painful experience only makes them worse. Is that accurate?
Not necessarily, whether talking helps depends on how, when, and with whom those conversations basically take place. Discussing difficult experiences in a safe, supportive environment, such as with a trusted professional, family member, or a friend, can help people process those emotions and gain perspective. At the same time, individuals should never feel pressured to share more than they are comfortable sharing, and respecting personal boundaries is an important part of emotional safety. So the goal isn't simply to revisit painful memories, it's to understand them, reduce their emotional intensity over the time, and developing healthier ways of coping.
Oh, that's a valuable distinction. Before we move to our next segment, I would like to ask about resilience. We heard this word often. What does resilient actually mean?
Yep, Maria. Basically, resilience is your ability to adapt and recover after adversity. It doesn't mean that a person never experiences sadness, fear, disappointment, or stress. Instead, resilience reflects the capacity to continue moving forward, learning, and finding ways to cope despite life challenges. So resilience is influenced by many factors, including your, supportive relationships, problem solving, emotional awareness, community connections, and access to appropriate care. It's something that can be strengthened over the time rather than a quality that people either have or don't have. So when someone, goes through trauma, they may feel overwhelmed, hopeless, or emotionally exhausted. And anxiety can make even simple daily tasks seem difficult. But resilience doesn't raise these challenges. It helps them face them on one step at a time, and it also allows people to acknowledge their pain and seek support when needed and believe that recovery is possible. So it's also important to understand that resilience isn't an inborn trait. Only some people possess it. It's a skill that can be developed and strengthened throughout the life. And every positive action, whether it's talking to a trusted friend, seeking professional counseling, practicing self-care, maintaining healthy routines, or learning coping strategies, helps build resilience. So there are basically several factors, that contribute to resilience, like healthy problem solving and decision making skills, and emotional awareness, and ability to express your feelings appropriately, and a sense of purpose in your life. hope, and optimism for the future. So, supportive communities and access to quality mental health care. But building resilience, like doesn't mean recovering over the night. And healing is really a straight path. There may be setbacks, difficult days, moments of doubts. However, resilience reminds us that setbacks are the part of the journey, not the end of it. And every challenge we overcome teaches us something valuable about our strength and our capacity to heal.
Okay, Mrs. Sarah, before we wrap up today's session, I would like to ask one final question. Throughout our discussion, we have talked about trauma, anxiety, emotional healing, and resilience. For someone watching us today who may be silent, struggling, what message would you like to leave them with?
Thank you, Maria. If there's one thing that I hope everyone remembers, it's that your trauma is part of your story, but it doesn't have to define your future. And experiencing trauma or anxiety doesn't make you weak, it makes you a human being. Many people believe that being strong means never crying, never feeling afraid, or never asking for help. But true strength is something different. It's called resilience. And resilience is your ability to adapt, recover, and continue moving forward, despite life difficulties. And it doesn't mean that you won't experience sadness, fear, and disappointment or stress. So those emotions are a normal part of human being, and resilience means learning how to cope with those emotions in healthier ways and finding hope even during difficult times. And the wonderful thing about resilience is that it's not something people are simply born with. It can be developed throughout the supportive relationships, emotional awareness, healthy coping skills, professional guidance, and self compassion. Every time you choose to speak about your feelings, ask for support, take one positive step towards healing, you are strengthening your resilience. So, healing isn't a race, it's a really a straight path. There will be good days and difficult days, but every step forward, no matter how small, is progress. So remember, asking for help isn't a sign of weakness again, and it's one of the bravest decisions a person can make.
That's such a powerful message. Finally, Mrs. Sarah, if your audience remembers just one lesson from today's discussion, what should it be?
Yeah, Maria, I would say this: never suffer in silence. Trauma and anxiety can affect anyone, regardless of your age, background, profession, and there is no shame in seeking help. And talking to someone you trust or reaching out to a mental health professional, healing is possible. So, hope is real. No one has to face these challenges alone. And when we support one another with empathy, instead of judgment, we create a stronger families, healthier communities, and a society where mental well-being is valued just as much as physical health.
Okay, thank you so much, Miss Zahra Ali, for sharing your expertise and for reminding us that healing begins with understanding, compassion, and hope. And thank you to everyone who joined us today for today's online talk show, The Silent Epidemic Understanding Trauma, Anxiety, and Emotional Healing. We hope this conversation has encouraged you to care for your mental well being, support those around you, and remember that healing is always possible. Until we meet again, stay kind to yourself, stay connected with those around you, and never hesitate to seek help when you need it. Thank you
Thank
so much. And okay, so if anyone has a question, you can um, open your microphone or text it in the messages.
I think so, Miss Maria. Everything is clear to the audience, right?
Yeah,
We don't
I
have
think
any
so.
questions.
Okay, perfect. So thank you so much to be here. Thank you so much, Miss Zahra Ali.
Thank you.
And so it's the end of this discussion. So thank you to everyone.
Thank you. Take care.
Step into professional mental health education with IMAHRKMI, where expert-led workshops transform beginners into confident professionals. From hosting and back-end operations to IT management and coordinating speakers seamlessly. Develop professional creative skills including Adobe Photoshop and Filmora video editing, guided by IMAHRKMI experts. Learn to record and edit live workshops with professional quality, all within your training program. Guided by instructors bring years of professional experience personally during each module. Stand out with a globally recognized American certificate issued by IMAHRKMI.
Gain hands-on experience simulating real online workshops, preparing you for professional practice.
Learn to host and manage online workshops efficiently and professionally.
Implement back-end systems and IT setups that keep your workshops running flawlessly.
Master speaker coordination, scheduling, and participant engagement techniques.
Design captivating visuals for your workshops with guidance from IMAHRKMI experts.
Edit recorded sessions professionally in Filmora to create polished content. Record each session with precision, ensuring high-quality content for your students. Collaborate with instructors, IT experts, and designers supporting you throughout the workshop. Learn from actual workshops conducted by our experts and discover best practices. Enhance your career with practical skills and an American certificate from IMAHRKMI. IMAHRKMI workshops are fully online, letting you learn at your own pace globally. Our workshops provide a safe, supportive environment for female students and professionals. Complete this workshop to gain practical skills, expert mentorship, and an American certificate to validate your expertise. Join IMARK and become part of a global community advancing knowledge, empowering professionals, and serving others. Welcome to IMAHRKMI, where new psychologists and students learn complete professional online workshop skills from senior experts. In our training program, students learn how to host professional online workshops step by step. You will learn back-end operations, workshop setup, and complete technical management. We teach how to manage speakers, participants, and live sessions professionally. Our course includes full IT training required to run online workshops smoothly. Students also learn graphic designing using Adobe Photoshop for workshop posters and presentations. We train students in Filmora video editing to prepare professional workshop recordings. You will learn how to record online events and edit them professionally. Our senior trainers are experts in their fields and guide students step by step. This course is specially designed for new psychologists and students. Students gain real practical experience during training. You will learn how to host webinars and online workshops professionally. Our training prepares you for real international level work. After completion, students receive an American certificate from IMAHRKMI. This certificate helps students build their career professionally.
You will be able to work in online workshops, webinars, and courses.
We are building an international team and inviting new students to join us.
Join our training program and become part of professional international workshops.
Learn skills, gain experience, and build your professional future. IMAHRKMI online workshop training. Learn, practice, grow, become professional.
Welcome to IMAHRKMI, the global platform connecting patients with top specialists from around the world.
Our team includes PhD psychiatrists, psychologists, sexologists, orthopedics, gynecologists, and surgeons providing expert care online.
Join interactive online workshops, short courses, and webinars guided by senior international doctors.
Collaborate with doctors from the United States, Germany, Australia, UK, Pakistan, and India. Become a member of IMAHRKMI, work with senior doctors internationally, and make your name in global healthcare. Gain experience consulting with international patients and expand your professional skills.
Earn an American certificate recognizing your expertise and professional growth.
Learn from senior international doctors, enhancing your skills in real-world online consultations. We are expanding our global team. Join us and collaborate with specialists worldwide. The new platform is excellent. Agreed. Gain practical experience in patient consultations, workshops, webinars, and short courses. Our platform empowers female healthcare professionals to achieve excellence globally.
Connect with doctors worldwide and collaborate on international cases. Work with senior international doctors and be recognized globally for your contributions.
Membership gives you access to exclusive workshops, patient consultations, and mentoring opportunities.
Build your reputation, expand your skills, and earn competitively while working internationally.
Collaborate directly with PhD psychiatrists, psychologists, sexologists, orthopedics, gynecologists, and surgeons globally.
Enhance your knowledge through IMAHRKMI's short courses and webinars designed for professional growth.
Take advantage of this unique opportunity to work globally, gain international experience, and earn an American certificate. Join IMAHRK today, work with senior international doctors, grow professionally, and make your mark in global healthcare. IMAHRKMI, advancing knowledge, empowering professionals serving patients worldwide. Become a member and start your international journey today. Welcome to IMAHRKMI, the Global psychologists. Our team serves patients internationally.
Our team includes PhD psychiatrists, licensed psychologists, sexologists, orthopedic online from multiple countries. Short courses and webinars giving professionals a platform to learn and grow from senior international experts. Join doctors from the United States, Germany, Australia, UK, Pakistan, and India, and collaborate on patient care across borders. Become a member of IMAHRKMI, work with international senior doctors, and make your name in global healthcare.
Gain experience working with international patients, expanding your skills while making a real impact.
Earn an American certificate recognizing your expertise and professional growth in global healthcare. Learn from senior international doctors and mentors, enhancing your skills in real-world scenarios.
We are expanding our team globally. Join us and collaborate with specialists worldwide while advancing your career.
Gain practical experience in patient consultations, workshops, webinars, and short courses preparing you for international practice.
Our platform is supportive and inclusive, empowering female healthcare professionals to achieve excellence globally.
Connect with doctors from across the world, expand your professional network, and collaborate on international cases. IMAHRK gives you the chance to be recognized globally, working with senior international doctors and making an impact in patient care. By becoming a member, you access exclusive workshops, patient consultations, and mentoring opportunities from world-class doctors.
Build your reputation, expand your skills, and earn competitively while collaborating on international patient care.
Work directly with PhD psychiatrists, sexologists,
psychologists, orthopedics from around the globe.
Enhance your knowledge with IMAHRKMI's short courses and webinars designed for professional development. Join IMAHRKMI today. Work with senior international doctors, grow professionally, and make your mark in global healthcare. IMAHRK, advancing knowledge, empowering patients worldwide. Become a member and start your international journey today.